Good afternoon, everyone. Thank you all for joining us for the 100 Families Alliance meeting. We always have a topic, and today our topic will be centered around the housing crisis and the effects on children and families. We have an amazing panel. Before we get started, I definitely want us to, our protocol is we have Paul Chapman, who basically for our newbies, give you a little bit of history about 100 Families and Restore Hope for our alliance and things that we've done, how we've, the data in other counties and how we're progressing here. I will say I'm so excited because we have April and some of you that are on here did not attend the launch.
Just texted you. Does that bother you?
So engaged and coming out and supporting the community. And your effort, everything that you're doing in the community, it's for the community, by the community. So I'm going to turn it over to Paul. He's going to give a little, the information, and then we're going to go turn it over to Karen about the data, and then we're going to start our panel and our discussion.
All this, we're actually up in Northwest Arkansas and have had to set up here. We're giving a presentation at a juvenile justice conference here, and just right after this, there's a good bit of science for population level change, or how do you actually have kind of real sustained change in a community that's baked into what we all do. It launched first in Fort Smith of the community working together there. One of the outcomes that that came out was that parents who had lost their children to foster care in that community, if mom guardian will choose to work with the 100 Families Alliance. And so there are lots of other things that came out, but to be able to have all kinds of interactions and working together and solving problems together. And so thank you for being a part of this. I and as well as Shauna, we worked together for a long time, but we live in Pulaski to us. And we're so we know the problems deeply and intimately within the community, and we're ready to. The things that we have seen is that once we can start to produce some throughput and work out some of these problems and produce outcome, is we're able to get additional resource, whether that be through reallocations, and that's not when I say us, I don't mean United Way or Restore Hope. I mean, the Alliance is able to then do what we do, like outcomes for that. And so origins all have collective impact, kind of science-based in it. But even though there's kind of principles of then just comes down to us, is can we work together? Can we be innovative enough to come up with the next solution that is contextualized to our particular community? And because I can be a knucklehead sometimes. Will she push through, frankly,
Still here.
She's still here. So far she's done it, and she's had ample opportunity in 10 years to run away. We're going to have to figure out how we're going to work together to be able to solve the problems, very complex problems for our clients, for our neighbors, that we all want to live in. So thanks again for taking time, and thanks for working on problems like this.
Thank you, Paul. All right, over all the counties. She was here. She's been here since conception of 100 Families. She has all the data, those numbers, the important stuff that you got.
Thank you, Shauna. So 100 Families is different and exciting because while I work for an organization called Restore Hope, and Sean Graham works for an organization called Department of Children and Family Services, we are all 100 families. I just want to remind you of that, because as you do the work in your community and part of the Alliance, you are with 100 families. We are together working on this initiative. So our mission at Restore Hope is for foster care, and 100 Families came about because of that. And the 100 Families, of course, is a community-led initiative. We engage community group case managers to respond when a family is in crisis, and we have partnered with United Way to do that and bring funding and resources in our area. So we have officially launched 100 Families in Pulaski County now. This is the first meeting after the launch, and we're so excited. Now there are 75 active families in the 100 Family Alliance, with almost 200 children in those families and 90 families. So this is the data, and this is the exciting part, because if you case manage through the collaborative case management system, the data, and this data is at intake, and then every single month we re-pull it to find out what is happening on the client level. We have to have this collaborative, but how do we measure this population change, level change? And this is it. This is how we measure it. So as you can see, is crisis, that bright red, and at the top is at intake, and then and that softer color is at risk. Navy color is thriving. So our goal is to move people from crisis to stability to thriving. And I wanted to just point transportation. You could see that 1 out of every 4 of the families that we enrolled were in a transportation crisis when they came to us. That no vehicle, no bus passes, just not any transportation of any kind. And you can see that went down to 11%. So there's a 15% that's there. Another area that I saw that was a very good outcome so far, and let me tell you, I've been watching this over the months better in Pulaski County, and that makes me really excited. So when I looked at the data we last gave you, and then I looked at the outcome data from this in people's lives, because that's why we do what we do. So the housing, you can see stabilized. There was only 16% stabilized after homeless. 53% were at risk, which means they were either living in substandard housing, overcrowded housing, they were being evicted, something like that, or in a thriving housing situation. They were able to pay their rent for a year or more on time. So together, that's 27%. What you can see now is that increased a great deal. So 52% flip-flop we want to see from crisis and at risk to stable and thriving. And so that was one of the most exciting area. You can see improvements. I mean, just look at the food, for example, 28% to 45% became stabilized in food. I got excited when I saw 30% to 45% were thriving, which means they are, in recovery and doing very, very, very well. And not using definitions across the board. So it doesn't matter where you do intake at. You could do intake at our house. You could do intake at DCFS. You could same kind of data back as far as the definitions of whether someone's in crisis or thriving in each of these areas. We provide this resource, we provide the training, and we want you to be part of it. Let me see what else. Here we go. All right, so just the types of child welfare cases and our primary providers. The referral types are, we get a lot of referrals from the Arkansas Community Corrections Office, the health organizations, Little Rock churches, and some other nonprofits as well. So I just wanted to give you all that, and we'll go straight to the panel, Shauna.
All right. Remember, this is what you're doing as an alliance, as a community. And like Karen said, if you want training on this collaborative case management communication system, we can provide that for you and give you the process of referrals. And the cool part about it now with our trainings, you don't have to be in person. We can actually send you a training. You can pause it, you can rewind it, and everything is at your fingertips, and you can get a log in after a debriefing with me, and you'll be trained on the system. So we do have an awesome panel today in our county, here in our state, actually, and it's actually nationwide. Housing is a crisis, and it's affecting our families. Pulaski, it has become a crisis, and we have more children in foster care than we have had in the past. There are currently 880 children in care. And while we have found that one of the reasons that the children and families are struggling so much is their inability to find some of the things that we do realize, building an effective housing response system. We have different emergency housing, transitional housing, supportive housing, below market rate rental housing, vouchers, rapid rehousing, market. We're going to talk about these things today. And all of my panel here, they tie into the housing spectrum in some way. Okay. I'm going to actually give their names. They're going to tell you a little bit about themselves, and then we're going to go into a little discussion. We have Dr. Jarman. She is and what she does. We have Ms. Johnson, Connie Johnson. We have Pastor Graham, Representative Love. We have Ruthie Hawken, and we head off with Dr. Jarman. Can you tell us a little bit about yourself and a little bit about what you do? And then can you introduce
Sure, yeah.
Ms.
Good afternoon,
Johnson?
everybody. I'm very happy to be part of this panel. This is my first time participating on a panel of this sort since coming here to Little Rock. Raised in Conway, so I am a native Arkansan, so this is really near and dear to my heart. I left right after college and have just now, this last year, returned. So I've been all over. I've been doing housing for well over 35 years. And I started in Dallas, Texas, when I was working on my doctorate degree. And as part of that process, I was sent to do a fellowship at Yale University that allowed me to do a site. Part of my fellowship was in Louisville, Kentucky. And times I used the word deployed to Gary, Indiana 3 times. And then, of course, New Orleans, where I was there both pre and post Katrina. So I've been doing this a while, been doing it all over the United States, fully recognize the issue and the totality of it. And I really appreciate being part of this panel. The housing choice voucher, some people recognize it as Section 8. Ms. Constance Johnson, I recruited her after I got here as part of my A team that I've assembled at the Housing Authority. I really only just assumed the position full time in April. Prior to that, so I'm going to allow Ms. Johnson to introduce herself. And so, Constance.
You're on mute. Ms. Johnson, can you please?
Hello. As she stated, my name is Connie Johnson. I am the director here for the Metropolitan Housing Alliance. I want to first thank you for the invitation to sit on this work with all of you with a shared goal of assisting the community. My background in housing started well over 20 years ago. I actually started in the housing industry as a participant. So I started, and then the rest is just history. I worked my way up the ladder to be where I am today. So I although I'm new to the Little Rock area, the passion to help is not new. So I bring that passion and resources to our community. I bring that passion to the Little Rock area. And I look forward to working with each and every one of you with our vouchers that we have available, both our regular Section 8 voucher, which is our emergency housing voucher. So I look forward to working with everybody. And again, thank you for the invitation.
All right, Representative Love.
Good afternoon. And as everyone echoed, thank you for having this panel. Thank you for having me on. So I serve as the Director of Community Services for Pulaski. By way of being the Director of Community Services, I have a housing agency that is under my purview. We are a smaller agency in which we have about 325 housing choice vouchers. Then we have make up our public housing agency. We have permanent supportive housing. We're bringing on domestic violence. We do AESG, we do TBRA, so we do some of everything. Thank you for having me on this panel. I look forward to speaking. I'm actually, it's good that you have this panel because it brings people together. Because I've never met Dr. Jarman, even though I'm Miss Johnson on other panels. I do work with Miss Spencer, and I know Pastor Graham, but I haven't gotten a chance to work with Ruthie Hopkins. But I do work with our house. Hosting this panel, I think I look forward to being on and look forward to sharing my insight.
Great, thank you so much, Representative Love. Ruthie.
Hi, everyone. My name is Ruthie Hokins. I am our lead case manager in our family stability program at our house. It's the CAFSI program. It stands for Central Arkansas Management Program through our house for the last 7 years or so. I've been at our house now for 7 years. I've been in this role as a CAFSI case manager for 5, and I've been leading our team for the last 3 years. So I've worked with for that time in a long-term case management program. So we work with our families who live in our shelter at our house, but also in our community who are either living in other shelters or doubled up, are at risk of homelessness, are facing eviction, and we work with them for about 12 to. So I'm really glad to be on this panel too. I feel real honored to be among a panel of really well experienced, great.
Thank you so much, Ruthie. Michelle.
Hello, everyone. As you stated, I'm Michelle Spencer. I currently serve as the CATCH COC program coordinator for the city of Little Rock. I've been here about 6+ years, better known as CATCH. CATCH is a nonprofit and serves the continuum of care for Central Arkansas. And we are set up to, I am set up to assist with the coordination of CATCH and monitoring of service of area, which is Lono, Saline, Prairie, and Pulaski County. The city of Little Rock partners as a collaborative applicant for Central Arkansas. And I'm very delighted to be here with you all and sit on this panel as well.
And last but not least, Pastor Graham.
Good afternoon. Again, I'm honored to be a part of this distinguished panel and also the 100 Families Alliance meeting. Thank you for thinking enough to serve as the statewide team decision-making supervisor for the state of Arkansas. I'm a career employee. I've been serving 28 years with the Department of Human Services, Children and Family Services, also 23 years. I've served in a number of capacities and have had, I call it an education, working with Children and Family Services. Started working in other positions as a supervisor, county supervisor, and then most recently, before I became the supervisor of the team, worked with our house quite a bit as a worker and also also as a director, got a chance to know the former director of families in crisis quite a bit, also, and working with as a senior pastor with Bethesda Missionary Baptist Church about 15 years ago, founded operate a clothing closet mentoring program we work with. Also, one of the things we were able to do to work with a lot of the young men aging out of the foster care system. We operated it for about 2.5 years. Unfortunately, it was a victim of arson, burned down, and so we're hoping to still work through that ministry. But it's also young people who a lot of people don't recognize who age out of the foster care system and reach the age of majority, or they're in need of housing. The team decision-making unit is a group of facilitators that supervise around the state, and they meet with families in crisis where children are about to be either removed of issue or they've already been emergency removed. And so those facilitators, they mediate, facilitate a meeting during a time, especially those who are going through domestic violence and abuse. So it's quite a joy and a privilege of mine to be able to work with those group of people. Thank you for asking me to be here on this.
Thank you all so much. I told you we have a wonderful panel. So we're going to get started. So when we think about providing an effective housing response system, we know we need sometimes refer to the spectrum as the housing continuum of care. Can you explain that continuum to us, Michelle?
Yes, the COC, which is the Continuum of Care program, is designed to promote community-wide commitment to the goal of ending homelessness. Nonprofit providers, state and local governments to quickly rehouse homeless individuals and families while attempting to minimize the trauma and dislocation caused to homeless individuals, families, and promote access to, in effect, utilization of mainstream programs by homeless individuals and families, and to also optimize the self-sufficiency among individuals and families experiencing homelessness. Now, for our COC for Central Arkansas, it's incorporated. We are a nonprofit member organization whose mission is to provide a community-based system for empowering those homeless and those at risk of being homeless to access housing and services that meet their needs. We are operating providers, city, state, county representatives, and one staff member, which is myself. CATCH currently has over 30 organizational members and about 95 individual members, and it's ever growing. And we're always that would like to get more information, just contact me. I will provide my email address later in the chat. And some of our service provided under CATCH is community-based services for substance abuse and related disorders, life skills for homeless families with children seeking to achieve independence. We have those available. We have an organization that assists men and women in a total change in life through effective treatment services, and they provide crisis intervention, emergency shelter, social legal advocacy, and a few of the many services we provide. So that's the continuum of care for Central Arkansas in a nutshell.
Thank you, Michelle. And I have had the pleasure of being able to sit on that discussion and on the board with you. I also love the fact that with the continuum of care, it's a holistic approach and everyone's working together. That's why it's so important as the Alliance grows. We have that communication tool that we can all use so everyone can communicate together to reach families that are in crisis, move them from crisis. Welcome you all, and thank you, Michelle, for that.
Hey,
so now let's move on.
Can I add something to that?
Yes,
Can I
please.
add something to that, Ms. Bruce?
Yes.
And I want to just reiterate what Michelle said in regards to President several years ago. In the continuum, the continuum is an ideal that it can only grow and get better as we add members, because the whole thing is it's predicated on you being able to reach a member that can serve health, or if it's physical health, or if it's whatever the issue is, that continuum needs to be able to solve it, because it's just a wraparound. It's a wraparound for a family, whether it's domestic violence or whether it's somebody have you. Is that if you don't, the continuum is only as strong as the members that are involved in it, and so we need everybody involved. And so that's just one thing that I would like to reiterate, because we try to provide the vouchers and different things, but the thing about it is there are other services that are critical to these families when we go and talk to people at homeless camps or different things like that. And so I would just want to, as far as we're always looking for members, because the continuum is only as strong as its members.
Absolutely. Thank you for that, Representative Love. And since we have you, we're going to keep on questioning you and have you to continue eviction prevention. So eviction prevention is very important right now. Pulaski County is not participating in the Arkansas renting funding available. Can you explain the assistance, and does it work similar to the Arkansas rent relief?
Sure. So Pulaski County is not participating. The money from Treasury came down due to population. And there was 2 other counties besides Pulaski that received their own allocation, which is Benton County and Washington. In rent relief, we're just not participating in the state program because of the population size. And so we got our own allocation. And so the program is basically set up in us. There are some nuances in programs. So you're able, they provide you with a framework. So we're basically here to provide rental, utility assistance, which dates back to if you are a family that is at risk of being homeless, vulnerability, those things play into it. But the framework says that we can have a rent assistance up to 12 months, and then we can go up to 15 months. I mean, we can pay your arrears in 12 months, and then 3 months ahead to ensure that we stabilize your home. Same basic framework. So we all work the same. Our application is online at www.pulaskicounty.net. You can log on, you can fill out your application electronically, you can upload your documents. Of course, as you know, Internet Arkansas is number 51 in internet. And so we are trying to make the transition. And I mean, people have to bear with us. Then we had to add the meat to the bones. And so it's kind of hard getting a brand new program stood up, because you would think as a housing agency, we're just going to do, you are going to get audited and you're going to be paying out back a lot of money. So, but Treasury has these strict rules on how they laid out the program. And the reason why I want to really go through this is because a lot of people, what they do, but it's not specifically how Treasury needs it, because we have to be able to track the number of months of assistance that we give you. So if you are a renter, we're going to need your ledger by month. If it's a utility, if utilities, we have to have that broken down by month, because Treasury is saying, well, we can only help you 12 months. Well, if your bill, we can only help you up to a specific number of months. And so these are kind of things that we kind of have to walk through with our clients, because Pulaski County has, since we've opened in April, we're one of the first programs stood up. And I tell you, hats off to the DHS, because I would tell you this, when they started their program, it showed that there was a need for the program.
Yes.
However, I will tell you this, I mean, our phones are ringing off the hook. We're trying to assist and help everybody. So I think it's something that, but also please be patient, because we have to get the correct documentation. Because at the end of the day, I went through this with my auditor. I have to be accountable for, we got $12 million. I have to be accountable for every penny of that $12 million, and there's nothing that I want to pay back. And so I want to make sure that we are operating in an efficient manner so that we can get the services needed to the people. And so we try to have a 10-day turnaround process, but the one thing that I would stress, but it would help, if we get it in a format that we can use, because they can upload it, and then that's just a simple way. But we are also the county buildings, we are beginning to take people and help them fill out their applications. So you can call area code 501-340-3376 only if you live in Pulaski program. But the best thing to do is just log online to PulaskiCounty.net and fill out the application and upload your documents that way, so that we can get it, and then we can get you started. So, and everything, rent, utilities, and we're paying fees. Programs differ, but so you don't hold, what the state is doing with what Pulaski County needs. If you have anybody that needs that assistance, have them log on so that we can help.
Sounds good.
I wanted to make,
that's great.
Oh, sorry. I hope I could just interject and make a small plug too, because at our house, we have this financial last summer during the pandemic, where we're making appointments with folks over the phone for them to come into our career center building on our house campus to help fill out applications like the rental assistance, getting documents in order, ordering documents that they need to be able to upload those and actually, provide that one-on-one assistance and platform to really help folks accurately. And if we, through the Financial Navigators Hotline, we've also worked with individuals and families to get them plugged into employment, job training programs, and into our shelter if they need to. So I'll put that information in the chat too. But Rachel Bornay from our house did as well. But it's to get that one-on-one assistance for, as Representative Love said, when you need internet access, and doing it on mobile really isn't an option, and you really need to sit down at a computer and be able to.
Absolutely.
To have that
Thank you so much, Ruthie. I'm going to circle back around to the importance, just the voucher money, Representative Love and Ruthie, to give some more information if you have that. But let me ask a question about emergency housing to Michelle. I know you have to get off, because you have just briefly tell us now, with emergency housing, many families that are evicted, they find out that they have nowhere to go. Some shelters, and whether they are typically full or not, and whether they are able to serve families with children. And then we're going to come back to the rental
Okay, yes,
part.
Lashana, we have several agencies that assist with the rapid rehousing services. And we have agencies that provide emergency shelters in Central Arkansas, families depending on individual needs by providing a wide spectrum of assistance to individuals. And did y'all lose me? Can you hear me?
We hear you.
Okay.
We don't see your video, but we can hear you
Okay.
clearly.
Salvation Army of Little Rock, who provides emergency shelter to women, children, families, providing showers, lunch, and dinner. They have guests are able to stay for a certain amount of days, depending on their immediate needs. Like Lucy mentioned, our house has an emergency and transitional housing. Guests have to be willing to work and start a savings. Individuals are able to stay for a number of days in emergency shelter and can transition over to the next program if it is a good fit for them. They are then able to stay up to about 2 years if needed. Our house operates on a first come. We have Compassion Center, who provides a low barrier shelter to a large number of our local chronically homeless individuals. They provide shelter to men, women, and children between 2 shelters and 2 separate sites. Compassion Center is the largest shelter in the state and usually has the capacity to shelter. Now, their guests must check in and out daily, each morning, and return in the evening if they are in need of shelter. We have women and children first, violence situation, and you can be in a safe place rather quickly. They're providing one-on-one counseling and services to meet the need of the individual. Men with children are also allowed as well if they are fleeing a domestic violence situation and need shelter. We also have they have shelters of individuals who are dealing with substance issues and need shelter. Guests receive one-on-one assistance with their immediate needs. Guests are able to stay for a period of time designated by the agency. Now, I've mentioned most of these agencies that assist with homeless and those at risk of homelessness receive federal. Several of them have the ESG funding, which is the Emergency Solutions Grant funding, as well as the Continuum of Care funding. The COC receives about $3 million annually to assist the homeless and those that receive. Our house and Pulaski County government currently receive the COC funds to provide direct services to those in need. I'm going to move down a little bit and just let you all know that the Shelter Plus Care with Pulaski County is one of our 2 permanent supportive housing to individuals with physical and mental disabilities. So that's a very major asset to our community to be able to house those individuals. So I wanted to touch base to let you know, yeah, we have the rehousing funding that's out there and it's working in our community. We just need more of it.
Yeah.
If you would like a list of all the shelters in Central Arkansas or contact information for any of the agencies that I mentioned in the actual chat box.
Yes. Thank you, Michelle. And if you could provide that list for me as well, and we can make it available to the entire information in there in the chat so we can have access to that. Thank you so much, Michelle. That's great information and great to know. Now we're going to go back to the rental part. Now, the largest year for monthly rental assistance that's ongoing. So I know Representative Love and Connie Johnson can provide this, and why the wait lists are sometimes closed. And the other part to that, what's the demand and the issues with getting that with us? And don't beat me up for that question about that wait list.
Connie, I'm gonna defer to you, but I will do cleanup on this one because when I saw this question, I really wanted to
then put me on the hot seat. Okay. Oh, wow. Okay. The first question I guess I would address is why it's limited with funding. So HUD only provides a limited amount of funding, which would only assist so many individuals. So this is why waiting list. And unfortunately, you know, it's not always a good thing because there are people who want to be on there, who need to be on there. But again, because our funding is limited, we are issuing vouchers too. You asked another question, the demand. The demand is extremely great, especially with COVID. Everyone knows with COVID, a lot of people lost their jobs. And so a lot of people are facing or have experienced homelessness. And this is, I believe, is one of the reasons why, you know, the new funding became available. And I'm just at $1 billion in funding was allocated today. So that's a good thing.
Wow.
So, and I would imagine it's a direct result of COVID. So it's limited. So we have to just use what we have to assist as many people as we can assist. And this is why there is a need for the continuum, so that we're not reinventing the wheel, so that I could take, Michelle provided me with a listing of participating
Yes.
agencies in our continuum. It makes it easier for everyone in the continuum to just look on this list and say, oh, I need somebody to assist with mental health. I need mental health. I need someone to assist in this other area at the housing authority, because that may not be our niche. And so I would rely on Michelle to say, hey, Michelle, can you give me some vouchers? And it's funny because I see some of these faces. We were just on a call earlier this morning discussing this. So it's wonderful to be in the continuum. This is why we need the continuum. We need participation to make this a smooth transition for the community. I hope I answered that question.
Okay, I will. But before that, I'll yield to Dr. Jarman, because Dr. Jarman, did you want to say anything in regards to the wait list?
You're on mute, Dr. Jarman.
Can you hear me now?
There we go. We can
Yeah,
hear you now.
I
Yes,
want
ma'am.
to reiterate a couple of points. The wait list is a national phenomenon. It's not just local. The need far exceeds the supply, and there's always going to be a really healthy wait list. As Director Johnson explained, it would be when we know we can only serve so many people, and we only have the resources to address so many people, and we don't want to give false expectations. So that's one of the reasons why we actually have to open at some point. Whenever we purge our wait list or we extinguish our wait list, we do have to open it. But again, you don't want to give false expectations or our home. I want to reiterate too, it's so good to be on this call, because just as Representative Love said, I've not met a lot of people in person. The pandemic has prevented that, but I do want to reiterate that we're team Little Rock, team Pulaski, team Housing. Mr. Johnson already mentioned we used that when we had to get the word out about our emergency vouchers. It was very, very helpful. The CAT, we're just happy to be part of the team and ask you guys to give us a little time. This is a new team to Little Rock. Again, Ms. Johnson's been here a couple of months, and so we're gelling now. I'm gonna be part of this.
That's right.
And Representative Love, I thank you for trying to put me on the hot seat, but I'm right.
Okay. Well, no, I just kind of defer to you, because I know that you have a lot of a little bit further, so that people can truly understand. Because when people think about housing, they think about what intuitively makes sense, and then when you begin to, I have 325 vouchers. Right? That's what HUD has allocated me. 324 of my vouchers right now are full. Families it's just 325 vouchers. If I stay full, then there's no movement on my wait list. And as Dr. Jarman said, it's a disservice to open, you're going to be able to be serviced. So let me tell you how the wait list opens, because I think Harriet Phillips had a question about what prompts a wait list to be open. So, since I have a small housing agency, I usually say I want 150 people on the wait list. Okay. I took about 200. All right. How the wait list works is this. I have 325 vouchers. If all of them are full, I have what they call an attrition rate, meaning that will sometimes violate the program rules or whatever, and they will be terminated from housing. My attrition rate is 2 people per month. So basically I have 24 vouchers to actually give to people. Right? And so if I have a wait list of 150 people, and I have 25, just say roughly 25 vouchers to get to 150 a person. And so that's why you don't open your wait list all the time, or you keep it open, because if your attrition rate like mine, it would take a lifetime to get through 250 people. Right. And so you do, and as Ms. Jarman says, you work your program, you work to make sure that the vouchers are it's not 325 a year. It's 325. So the funding is for 325 vouchers. So this is not an annual thing that they give you 25 slots. They funded 325 slots. So I wanted to kind of make sure that the people understood that your attrition rate really dictates what. Let's say, for instance, Metropolitan. I remember several years ago they got knocked because they said people were on the wait list for 5 years. But if you open your wait list, hurry up and close it, but your attrition rate is not that great, guess what? People are going to be on that wait list for years and years, regardless of if you purge your wait list, because you could send the information, you keep them on your wait list. So, I mean, housing is not as simple as people make it seem, because there's a lot of.
Can I piggyback a little on what Representative Love said?
Absolutely. And let me say this, but now I kind of understand, because I'm like, really? Yeah.
I totally agree with what Representative Love said. And let me add from experience, when I was on the waiting list, I was on the waiting list for 9 years. For 9 years. I also want to add to that, that although Representative Love said he got a little over 300, you don't always make that mark because you have to juggle if that 300 people needs a lot of funding. They're not employed, and therefore we are providing more subsidy. Then that 300 can be even.
Wow.
And HUD says, don't go over that 300. And if you use more than the funding that we give you, now you're in a shortfall.
Yeah.
So we always have to balance that the funding get more. Oh, we would love more, but HUD would have to provide us with the funding to increase our allocation. So it's always a juggling act with the amount of people on our program. Around in the United States have the option of sending us people. So while our people can, we call it porting, our people can transition or port out to others. So that's why the waiting list is always like it is, because it's always somebody who can use the subsidy.
Right.
And then Harry, things like that. In our case, we exhausted our waiting list, and therefore we had a need to replenish that waiting list, which is why the waiting list is open as we speak. So that's the authority open their waiting list is when their current waiting list is low or depleted.
Thank you. All of this is great information, y'all. And for the sake of time, I want to go ahead and ask Pastor Gray, and how is housing availability affecting these families that you're working with in a part of TDM and DHS?
Well, thank you for asking. It's a serious matter. When you're dealing with a family who may, someone mentioned the domestic violence issues are going on with some of the families, and children sometimes can be displaced or have to come into foster care because of this. Families are either in lack of housing or inadequate housing. Their families are sometimes in hotels or they're living with other people, and they don't have a place. So families in crisis, and it didn't, in turn, if children have to come to foster care because of this issue of, it's basically a poverty issue, and in time we're trying to not be able to, and when it comes to TDM, at that moment in time when we have recognized that there's an immediate safety issue where the children cannot have a place to stay, and you're coming to thank God for the 100 Families initiative, because if we can bring housing and those who have emergency housing, the whole point in team decision making is not just the family and the agency, but one of the things, as a matter of fact, we expanded TDM in the area A, which is Jonesboro, and those areas up there. But in Pulaski County, we're glad that we have the 100 families because it affords frontline workers, the case workers, and supervisors. They're there, but they need the input of these community stakeholders who have the resources, who can make the immediate impact. Because if you come to a meeting and you don't have someone who put then what's going to happen is that you're possibly have a child coming, or children coming into, multiple children coming into foster care because of not having that housing.
Right. So I'm sorry, did you finish, Pastor Graham? And kind of.
Okay. Yeah. Okay.
Yes, absolutely. So it can affect a family where a child can be taken into DHS custody, and until that family or that parent finds child is in DHS until that's taken care of. Correct?
Well, and it may, because if you happen to file a petition, go to home, because then you're tied up in the court system, in the juvenile court system, because then you're going to go through the probable cause hearing and then possible adjudication because of the child welfare system itself. Because now you have children that may have come into care not just because of abuse or something like that, but it's because of probably lack of housing.
I wanted
and
to
now you got to.
Hey, Ruthie, can you
ask your question? I'll answer it.
Oh, I was going straight to you because are transitional homes available, and how do we as connectors keep up with the availabilities when they come up available at our
here's
house?
Something that, so I've been on the Catch, I've been at Catch meetings, I've been at Arkansas Homeless Coalition team meetings, and action that has been asked, and the answer is there isn't an effective way to do that, because beds don't stay open, especially for families. So never closed our shelter during the pandemic, but we had to limit the number of beds by half that we were serving so that we could have safe social distancing and mask policies. And we've been really fortunate. We've been able to, which is a huge accomplishment, given how community-based living can impact that. But our housing is first come, first serve. Housing program into our shelter, you have to be willing and able to work. You don't have to have a job when you first get here, but you have to be willing and able to work, and you have to be able to, you have to have enough beds for a family come in, and we were one bed short because we've been opening up slowly to add more beds as we've had more vaccinations. We've had vaccination clinics, as numbers are just generally decreasing. And, I met with the shelter and there isn't enough bed. They get kicked down to me because my team works with families who are actively homeless, or who are looking for alternative places or having to find a place to be doubled up, do a lot of coordinating with families who are in crisis over the phone, in real time. And we were able to make an exception to the family, move things around to get them in, because that mom had no other option. And it wouldn't be an effective way. It would be someone's full-time job to just constantly be updating something. And we can't say, even for me in my program, the CAFC program, we have families who are in domestic violence situation who, might, because they're doubled up, those are often crisis situations. They might be couch surfing. Just because you're living in the home of a relative or a friend doesn't necessarily mean that's why I need a bed at our house and I just have my one child. I could say, first come, first serve, you got to be here. I'll try my best to reserve it for you. I can't actually do that because there could be a mom walk to bed because they were here first. And we do that to be equitable. We do that to, allow, families as much as possible to get that opportunity. I mean, ultimately, I think one of the case managers like my team operate in is that there just aren't enough beds in the county. There aren't enough beds in the state for the number of families who really need a safe place to be, so that or who live in hotels. And I've been working with a family for the last several months who it's a 2-parent household. They have 5 kids and they've been in one hotel room. They don't qualify for rapid rehousing. And same with families who are doubled up. If they don't, if they're doubled up and they're contributing to that rent in some way to be able to stay there, they don't qualify for rapid rehousing.
Okay, go ahead, Ruthie. I'm sorry.
So
my mind is just, it's going because y'all, we have gone over time, but this is just so important because this crisis is really, truly hurting families in Arkansas. And this question that I really want I want y'all to start thinking and dreaming. We have Mary Carol Peterson who was saying, are there ways that churches can help? Because when you think about it, the availability of housing and units, it's depleted. We don't even have enough housing units in our county, in Pulaski County. Mm-hmm. What are the gaps in availability of units across the spectrum? Is it family units with 3+ bedrooms? Is it units for the elderly? And what about decent, safe housing? Is it felony-friendly options? What do each of you see as the biggest gap? And I want to also poll the audience and let them determine what they feel is the biggest gap in Pulaski County housing availability. And we have a question polled here. Are there ways that churches can help? We have to pull together. We have to work together because families are basically being torn apart because they don't have anywhere to live, So we need to start thinking. We need to start dreaming. So can you guys kind of elaborate on that? I don't want to take all of your time, but we really do need to touch this. So anybody jump in.
Let me start by saying a couple of things because what Ruthie, I'm going to say something that's going to dovetail on what Ruthie said. Mm-hmm. And here's just the state's biggest issue. And I am the keeper of the keys for the homeless management information system. And so the HMIS system is a data collection system for Arkansas, and it paints a picture of homelessness in Arkansas. Mm-hmm. Okay. Now, there's 2 or 3 things that's not happening. Number one, we don't have enough people using HMIS. So when we begin to report that data to HUD, it's going to be an incomplete picture because there's not enough agencies putting data in to paint the picture of homelessness. And so when people are asking, well, how do we get more funding into Little Rock or into Pulaski County or into any other part of Arkansas to say, hey, we need more money? Well, it's going to always be an incomplete picture because we don't have enough agencies within the HMIS system to actually paint the picture of homelessness in Arkansas. And so the HMIS system is vital because that's the system that HUD says, all right, give us this data. What is your point in time count? The point in time count is like a tool or instrument they use to take a snapshot of homelessness at a particular time. And so if we don't have enough agencies to go to actually look at that data and to put the data into the system, guess what we have? We have, just
No
say for
data,
instance,
no numbers.
if we have 100 entities in the HMI system, but there's 350 entities doing homelessness, well, then it's going to be an incomplete picture. That's not a push for me to say, hey, I need more people to get, in the HMIS. It's just the reality. And so that's just one of the pieces that HUD is going to look at to say, these dollars need to come into Little Rock, or they need to come into Pulaski County, or any other part of the state. So HMIS is a big component. But number two, what Ruthie was saying, the first come, first serve, and I do the same thing, Ruthie. What we have to do, and it's going to be imperative that we do this, is we need to develop a coordinated entry system. If we don't develop a coordinated entry system here in Central Arkansas or anywhere in the state, what's going to happen is you're going to have the people that can get to the resources, they can get to the resources the fastest. They're not always the people that are the neediest. And so if we don't have a coordinated entry system would rank the people to say, hey, this family is in more need of this family. So just say a single mother making.
Have you?
Go ahead.
I hate to cut you off, but have you heard of Hope Art?
Yes, but that's a complex conversation that involves HUD.
I'm just saying, HUD,
I'm not touching that one. I'm not touching.
I know.
That's
I know Representative Love. I know.
But what I am saying, what I'm saying is that we have to develop a coordinated entry system so that we can begin to rank and rate families based on need, so that we can actually get them where they need to be. So now we can have that conversation offline to start talking about what that metric looks like, and but
we'll talk. I'll be in touch.
The thing about it is the first come, first serve is pretty much what we have defaulted to since, and that's not a knock on our house or Pulaski County or any other agency. It's just what we have and what we think is equitable to do. However, it's equal to do, it may not be equitable. Yeah. Because the equitability would be to look at, what family is in need and then help the person that's in need. So the thing about it is we try to be equal across the board, but we need coordinated entry will provide equity in the system.
I would agree if we could have tiered systems of enrollment in a homeless serving organization, right? Like if we had two families, one with two moms, single parents with two young children, but one is working and one is not, and we could put the family that was working, say, in a tiered step down system, that they could go into a hotel or in transitional housing that existed and put the mom without employment in our emergency shelter. That'd be wonderful. But we don't have that system that exists, or we don't have those resources that exist.
No, that's what I'm saying.
Right.
We need to develop that coordinated entry system. Yes.
Right. I agree with you.
Just to address Mary Carroll's question about what can the church do to assist with the housing, the church got to mobilize, the church has to be advocates. And, I know nobody knows better than what Mary Carroll did with the call, well, the Children of Arkansas Love for Lifetime, where churches got together and started training and fostering adopted families. And because there's a crisis of not having enough foster home and adoptive homes. But, this is the issue of the homelessness so what not outside of the foster care system, because we have families in need. So I would just say, to her, and she's doing an awesome job with the City Church Network and bringing churches together to collaborate. There are a lot of large congregations, but then there are many more churches. I often say that none of us are as strong as all of us put together. So I would say the collaboration of churches coming together and saying, hey, we've had some, I encouraged during that period of time that some churches actually opened up family-like settings for children in care, but we can do that not in care, families. So coming together, building a coalition and say, hey, we, the church, can come together and, across all denominational lines and start to do some things and put our dollars together to see what we can do as a church family. So that's what I would say as far as that question.
Guys, we have really, this is a huge topic. Are you guys willing to come back next month so we can continue this? We have questions in the chat that we will not be able to get to. I really want to continue this conversation. If you could raise your hands on Zoom, show with a show of hands, who wants to come back next month and we continue this conversation? We continue talking, we continue working, brainstorming, because there are churches that want to get involved, individuals want to get involved. We want to have some type of solution to cushion this crisis. So let's come back next month. And also, if you could only build
briefing video, if that's possible,
more of one type of housing, what would you choose and why? Have that question prepared for next month. I'm going to send out another invite. We're going to continue this topic on next month's Alliance meeting. We're going to have those questions to you and get those answered. But guys, this has been great. I hate that we can only have an hour, but Connie, you have.
Can I ask a quick question? Because I think this group would be a good group to start a collaboration for our emergency housing vouchers. We have a number of organizations here. And this would be a good start to move us forward on these emergency housing vouchers, which will become available on July 1. So if at all possible, if we can schedule something before next month, like within the coming weeks, that would be wonderful for us to get all on the same page. Because if I'm not mistaken, the majority of you are a part of the COC. Who we've been dealing with already. So, but if we can get a meeting schedule so that we'll all be on the same page, so that we all know what our responsibilities are and what we need to do, that would be most beneficial to the EHV program.
Yes.
And
so Connie,
let me just interject. You can go to the MHA website to get more information about the emergency vouchers. Director Johnson has been actively recruiting referral agencies. And so if you'll go to our website and www.mhapha.org.
And it's in the chat. That website's in the chat.
Thank you.
Yes. Dr. Johnman, thank you. So why don't we do this? Connie and I will get together. We're going to have a small group that we'll meet, and then we could do a small group meet before the July 1 date of just really our panel. And then when we come back next month, we can keep it for that second Thursday of the month. And when we come back, Connie, if that's good, we'll do a small group and then we'll come back for the Alliance meeting on the second Thursday of July.
We give folks the opportunity to think about, like, have churches.
Hold on, Paul.
Are there, so one of the things I'd be interested in is, are there communities where churches have participated with the housing authorities in ways that have had real success?
Yes.
And would that be transitional housing? And then how do we go about educating churches that might want to participate? So those are things that we could look at. If there seems to be some real interest, at least in the amongst the participants here, in investigating that as a potential solution.
Are these hands being raised, meaning they want to be part of that discussion? That's what I'm guessing. Okay.
Okay. So what I'll do is I'll send another Zoom invite prior to July 1 to be a part of the small group discussion. And then we will still have our Alliance meeting on the second Thursday of July, just to focus back on the same topic. Is that good? Because am I hearing a yes?
Yes.
All right. Sounds good. Thank you all. This was great. We have a lot to talk about and we have a lot of work to do. And this is for the community, by the community. We got to get to work, guys. Thank y'all for being here, and we'll be in touch.
All right, thank you.
Thank you.
Thank you, Shauna.
Sean, I'll tell Paul I wanted to try to talk with him as soon as I can to talk to him about another issue. I was on with our work group up in Area 8, which is Jonesboro and Lawrence County, Craighead County, Mississippi County. And I just want to find out when was his next area that he was trying to focus on bringing. I know he had talked about the expansion of 100 families. TDM is really big for our state and what we're doing with families in crisis and stuff. So, well, a big component to us really doing TDM the way it's supposed to be done is having the community stakeholders, which they have some, but we don't have it there. And so this morning on our work group meeting, I told the area director up there, Sherry Mangum, and also our lead strategist there, Pat Rideout, that I was going to kind of talk to you and find out what your plans were, what it would take, on your end to start talking about how do we bring 100 families to that area.
We're in those discussions right now. It's primarily funded by TANF, and so we're working with TANF right now on getting ready for expansion and trying to communicate to them what that would take. But I'd love to work with. I feel like we're at the point now where, in Fort Smith, we've had several years of tracking reunifications, and it's great. But now we're starting to track reunifications in these 3 other counties that we're in. And even though it's early, because we just launched, in the past several months, maybe 6 months in some of them, but the percentages of reunifications are, they're all 70% or above. And so I think it's a time we need to step back and say, okay, now that we know that when the community works in this way, it has really incredible impacts on family preservation or family reunification. So now we're the areas of biggest need. And so something that TANF has asked us to do, Phil Harris has asked us to do, is he needs a strategic plan. And so that's kind of where we are. It sounds very bureaucratic, that when all the needs going on and your team's on the front lines, but they're looking at, what does 5 years look like? And where are you planning to go? And that way they can go and try to allocate the dollars to it. But without the plan, we're talking about kind of such large amounts of money that it just won't happen just based on where we are currently. So did I talk around that? I try not to be too political.
Sound like
I'm not trying to dodge. I'm just saying the work that they're asking now is, wow, that's great. What are you going to need? And please tell us what you need, not today, but tell us where you need to go and how much is it going to take to get there. And let's engage in where everyone commits on the front end to exactly what it would be, rather than, trying to pay as you go and being surprised.
Right. So I kind of boil it down to kind of sound like there's dollars issues of being able to get, that's the bottom line there.
Yes, sir. It's dollars issues. The way that we currently are planning on getting across the state or to the major population areas in the state is to work with United Way and to have United Way hire folks like Shauna. So every county has a coordinator, at least the populated counties have a coordinator that already have relationship within the community, can put an alliance together. And then Restore Hope will work with United Way to provide the system and some best practices and that kind of thing. So we'll stay small and consultative. And then United Way can then take some of these TANF dollars and we will give them to the communities. We'll find the right nonprofits in the communities that want to play the case management role and make a grant to them through, so TANF to United Way to a subrecipient nonprofit who would then be trained for that point of what we call the point of contact. So they would come, for a point of contact for y'all, they come to your team decision-making meeting. They meet the guardian and they'd offer them help, and they wouldn't work for United Way or Restore Hope. We would have trained them, but they'll be a local nonprofit that has deep roots in that community that is playing that role that is a gap right now that's not really being played by anyone because there's no money for it. Can't bill insurance for it, really aren't any grants for it. And that's what we're trying to set up is how do we get the financial engine for the system, for the alliance, the coordination of the alliance, and then this case management role that just seems to be a gap for our clients to be able to get connected.
So I'm thinking in that area, there's some nonprofits there that kind of been stable doing some things up in that area. So I want to start those conversations to figure out if whatever I can do, is there anything that I can do or advocate to try to help that push because there's some good data that we've come out of since because TDM has been in most of those counties up there, but what we're really doing right now is constantly doing it the right way because of fidelity of the model, doing it where the families are really in crisis. And so we've already got, like you're saying, those families that are participating in TDM where either they're about to be removed or they just, the whole ideal is to try to have a live meeting. That live meeting is that they put up something in place that's just a stopgap. Hey, we think we're going to remove these kids and bring them to the table. But what we're missing in Area 8 is being able to have those community partners to come and be there and be there. And because if you have a plan where you got just the investigator and the supervisor and the family, that's not a good plan because DHS can't be everything. So that's what's missing in that area. And when we're wanting to go, like I said, in Area 2, we've already said, which is Fort Smith and Crawford County, where 100 Families already is and doing great things. So, hey, we're excited to go ahead and push. I believe that it's going to, because 100 Families being there, is going to really be great for TDM, but we're trying to leave Area 8, but we're concerned that they don't have we don't have that community partnership there.
Yeah, we in Northwest Arkansas, just for sheer population, Benton, Washington County, those are other areas that we'd like to get to quickly. Pine Bluff, El Dorado, Jonesboro, definitely. We're even looking at, we look at it a couple different ways, but here's what I'd really like to do. There's no mechanism yet for us to be able to do this, but I'd love to get, ACC with parole probation, DCFS, and actually, I want a good strategic plan, because y'all have got data and things that we don't. And I want to work with y'all, really lean in as a real partner with y'all to be able to get this done and get it done right. Because we just know that we're going to be able to transform, our target clientele, families in crisis. We know that we're going to be able to change the outcomes for them. And then we've got, we're doing things like we're working with some schools, but this trucking school, given the need for truck drivers, we just helped open in Little Rock. And now we're helping them move to Searcy. They'll open up here pretty quick in Searcy. It looks like we just found them some land. And it was good. It was a good contact there that loves their community. And they're going, absolutely, we'll do anything to get them here. It's that kind of thing that we're seeing in communities where unless there's coordination, I think of it as infrastructure. It's like roads the government builds a road, and I used it to drive up here today, but JB Hunt used it to make money today. And it's good, right? And so what is missing is human services infrastructure. It's absolutely missing because your investigator should be able to say, well, it looks to me like here are the things, right, that I'm opening a case on, and they define that. It shouldn't be as hard as it currently is for them to actually, get that client moved on so that they could quickly satisfy, because most of that help's actually in the community. It's just one, it's confusing as to how to get to it and how to qualify for it, and then two, they're probably at the lowest part in their least capable time of their life is when you're meeting them to be able to navigate, a parenting meeting and a counseling meeting, and by the way, the cars broke down and they've been using substances. to be able to try to navigate all that is just going to require some additional help. And that's what this case manager and the alliance and the system kind of does. It's just infrastructure to allow the help that already exists to be done and done effectively with communication so that everyone, the judge, DCFS, the counselor, we all know what's going on and can pull for that client. So that really the only thing that's left is their decisions.
Okay.
So anyway, I was all over the place, but yeah, what it comes down to is it's money.
Money.
Down to money.
Okay. All right. Well, I appreciate you taking a little time after this to kind of talk about that. But I just want to, there's things that I can do to help move that needle or anything I can advocate for. I told them that I was that. Yeah. Okay.
Yeah. Just tell them, hey, listen, this is working real well, and we need it everywhere. And and then we'll work within the other agencies, just like our human services are confusing and diffuse. So is kind of the decision-making process here. It's kind of diffuse because we need, partnerships with the agencies, but also with, DHS has funds that they could put in a community that's either through us or in partnership with us to pay for case management, but pay for case management that works in tandem with everyone else, because we did. We've gotten some grants for some other agencies that are our partners, but it didn't use it in tandem. So it didn't pay for the case management part. It just went to, you know what I mean? So it's, so we're still kind of learning on how to do this. And that's why I'm so interested in, I don't want to hire the case manager, but it's the golden rule, right? He who has the goal makes the rules. So I want the grant to go through us for very specifically, you play this case manager role and you're on behalf of the client, you've got to get them connected to everyone else, not just your organization.
Right.
Okay. That just is missing in our communities.
Okay. All right. Hey, appreciate you.
All right, Pastor. Good to see you. This was really good today.